Hi everyone. My presentation, I will be focusing on cognitive impairment, more specifically Down syndrome. So a little background. Down syndrome is a genetic disorder that causes a lifelong disability, developmental delays, and other problems. Down syndrome can vary in severity, so developmental problems will range from moderate to severe. Down syndrome is the most common genetic cause of learning disabilities in children. So what causes Down syndrome? Human cells normally contain 23 pairs of chromosomes. One chromosome in each pair comes from the father and the other from the mother. Down syndrome results when one of three types of abnormal cell division involving chromosome 21 occurs. So all three cell division abnormalities result in extra genetic material that comes from chromosome 21, which is responsible for the characteristic features and developmental problems of Down syndrome. The three genetic variations that can cause Down syndrome include trisomy 21, mosaic Down syndrome, and translocation Down syndrome. Defining features. So trisomy 21, 90% of the cases, Down syndrome is caused by this. It has the 3 copies of chromosome 21 instead of the usual 2. And this form of Down syndrome is caused by abnormal cell division during the development of a sperm cell or the egg cell. Mosaic Down syndrome, this is more rare form. Children have some cells with an extra copy of chromosome 21, and this is caused by abnormal cell division after fertilization. And lastly is the translocation Down syndrome. So children with translocation Down syndrome, they have the usual 2 copies of chromosome 21, but they also have additional material from chromosome 21 that attaches onto the translocated chromosome. Most of the time, it is caused by a mistake in cell division during the development of the sperm, egg, or embryo. Most of the time, Down syndrome is not inherited. Translocation Down syndrome is the only form of the disorder that can be passed from parent to child. Only about 4% of children with Down syndrome have translocation, and only about half of those children inherit it from one of their parents. So common symptoms, a distinct facial appearance, so flattened facial features, small head, short neck, protruding tongue, upward slanting eyes that differ from their ethnicity, unusual shaped ears. They have poor muscle tone, excessive flexibility, and broad short hands with a single crease across their palm. Incidence. Down syndrome occurs in every 600 to 800 live births. Some parents have a greater risk of having a baby with Down syndrome. So some of those risk factors, one is advancing maternal age. So women's chances of giving birth to a child with Down syndrome increases with age because the older the eggs, the more likely that there will be improper chromosomal abnormalities. So at age 35, the risk of conceiving a child with Down syndrome is 1 in 400, and by the age of 45, it's 1 in 35. Having had one child with Down syndrome already, so a woman that already has a child with Down syndrome, she has about a 1% chance of having another child with Down syndrome. And being carriers of the genetic translocation for Down syndrome, both men and women can pass that genetic form. Complications. So children with Down syndrome can have a variety of complications. Heart defects is one of them. So about half of children that have Down syndrome are born with some type of heart defect. This can be life-threatening, and usually it requires surgery at early infancy. Leukemia. Children with Down syndrome just are more likely to develop leukemia than children that do not. Infectious diseases. So because of the abnormalities in their immune systems, children with Down syndrome are just more susceptible to getting infectious diseases like pneumonia. Dementia, this is later in life. Individuals that have Down syndrome are at increased risk. they'll see symptoms and signs of dementia developing before age 40. Sleep apnea, because of the soft tissue and skeletal alterations, this can cause obstruction in the airway. So children that have Down syndrome, about 45% of them experience issues with sleep apnea. This also can cause memory loss and cognitive impairment. So for students, this can affect them in being tired and lethargic. Alternatively, this may result in hyperactivity. Other problems, gastrointestinal blockage, thyroid problems, early menopause, seizures, hearing loss, skeletal problems, etc. Diagnosis. So there's 2 tests that can be done. CVS is a prenatal test that diagnoses chromosomal abnormalities. So what happens is a doctor will take cells from tiny projections of the placenta, and they'll send that to a lab for genetic analysis. The advantage of CVS is that it's done earlier on in the pregnancy, usually between the 9th and 11th week of pregnancy. The second test is amniocentesis. This is a prenatal test that allows doctors to gather information about the baby's health from a sample of amniotic fluid. So amniotic fluid is the fluid that surrounds the baby inside the uterus. Similar to CVS, it's a procedure done during the first trimester. It produces a karyotype, which is a picture of the baby's chromosomes, and the doctor will be able to tell if there's any issues. Women that usually do this test instead of the CVS are often at increased risk for genetic and chromosomal problems. And in part of this test is more invasive, so it carries an increased risk of having a miscarriage. Manifestation and education. So all these that I'm about to discuss have a relation to behavior with children with Down syndrome. So sometimes children with Down syndrome may appear to misbehave when they are in reality just confused or uncertain about what they're supposed to be doing. So the child just may have not understood the instructions that were given to the whole class, so this could cause them to be frustrated. Or they may just have simply forgotten what they were being told. The most common form of inappropriate behavior in all children, including those with Down syndrome, is behavior designed to gain attention. So students with Down syndrome are attention seeking. It's usually because they always have an adult with them. So when that adult is working with another student, they may become resentful. And they are also used to getting special treatment. So they may object if it is withdrawn. Sometimes the child with Down syndrome will misbehave because they're angry or frustrated. Most of the time, children with Down syndrome will try to do what their peers are doing and realize that they can't cope without help. And they also get annoyed when teachers or peers don't take the time to try to understand what they're trying to say. Children with Down syndrome are often subjected to high level of structure and supervision. As a result, they may feel the need to exert some control over their lives. So they may just simply not collaborate with the teacher, just as a matter of principle. They may also resent being withdrawn from their classes and from their friends. Lastly, the child's immaturity may lead to behaviors more appropriate of a younger child. They may not have the concentration or memory skills of their peers, and they may also have more immature play and social skills. So what can be done to help that behavior? Strategies to provide support and assistance. Inclusion. So students with Down syndrome benefit from education in the general education classroom setting when best practices are implemented. So as long as the student is able to make progress towards those goals in an inclusive setting, the IEP team should not consider more restrictive placement for them. And lastly, all the supplementary aids and services that the student and teacher will need should be reflected in the IEP. So any behavioral plans, curriculum modifications, augmented communication, assistive technology, etc. should be in there. Muscle hypotonia. So muscle hypotonia is a medical term used to describe decreased muscle tone. So problems with mobility and posture, breathing and speech, and ligament and joint laxity. Students with Down syndrome get frustrated when their abilities to complete tasks are hindered by their low muscle tone. So giving them more time to complete tasks is helpful, and also providing opportunities to practice self-help skills can benefit them in the long run as well. And lastly is the speech intelligibility. So students with Down syndrome, because of their low muscle tone, they have jaw movement difficulties and motor planning difficulties. So this affects others being able to understand what they're trying to say. So many students with Down syndrome exhibit great differences between receptive and expressive language abilities. So using simple questions like the 5 W's and H, or if the student knows sign language, it's beneficial if the teacher learns just the basic signs so that they can have more effective communication between the two of them. Also, peer group acceptance may hinge on the ability to communicate effectively. So it'd be helpful if the teacher set goals in the classroom so that the student with Down syndrome can communicate, and also that their peers are able to have meaningful conversations and interactions between the two. And lastly, also speech therapist is usually involved in this. So as a school counselor, the main importance is always having contact with the student with Down syndrome, making sure that all the needs are met within the IEP, and just being there to help communicate through and with all of the individuals involved. And here are my resources, and that's it. Hope you guys enjoyed.